All right, welcome in. Good morning, everyone. Sorry, I had a little bit of user error getting started there, but it's 10 o'clock, and that means it's time to get this show on the road. My name is Randy Lober, Learning and Development Specialist here at Action Benefits, and happy to have you along for this rather momentous occasion in our industry, where we'll talk a bit about the Medicaid Unwinding. In particular, we're talking about prospecting the Medicaid Unwinding. What opportunities exist for you as agents and how can you find them here throughout this next year or so? And those tips and tricks and opportunities exist both in the individual and over 65 portions of your business as well. Joining me today is David Blackburn. He's well versed in this industry, got a lot to say about marketing and how you might position yourselves here today. David, I want to give you a chance to say hi before we go ahead and get started with today's session.
Good morning, everybody. Good to see some familiar names on the webinar today. We're looking forward to a good discussion.
Okay. Thanks, David, for joining us. We'll appreciate your knowledge and expertise as we go throughout today's presentation. So let's start first. We're talking about Medicaid unwinding. What exactly does that mean? It's been in the news going around. I want to present some fast facts to you here for us to consider. So throughout the pandemic, or the bulk of the pandemic, to be really accurate, Medicaid redeterminations were put on pause, which means over the last 2.5 years and some change, the Medicaid rolls in every state began to swell and swell and swell, leaving us in a spot where at the end of March 2023, where Medicaid unwinding began, approximately 2 million Michiganders were either on Medicaid or CHIP at the end of that month. We have about 8 million people in our state, meaning nearly a quarter of Michiganders were taking advantage of one of these two programs, and chiefly because that continuous enrollment provision was in effect, right? People were being booted off the rolls if they ended up making more money than the Medicaid threshold allowed. So because redeterminations are ongoing now and will continue to go through the June of next year, it's estimated, and figures vary widely because no one has great data on this, but some figures estimate at least 400,000 Michiganders, so of those 2 million, will lose Medicaid eligibility over the next year plus, simply because their income has risen to a level where they are no longer qualifying for the programs, whether it be Medicaid or CHIP. We should also point out that largely as we're talking to agents in the field, we all have this picture that the population that we're talking about here is under 65, right? We're talking about, especially because we see Medicaid and CHIP paired together, we think about low-income families, families with young children, but that's not strictly the case. There is a non-zero number of decent beneficiaries out there who will be facing redetermination. There's a non-zero number of people who might have aged into Medicare and need to take advantage of some special enrollment periods to find the plan that's right for them, which we'll highlight in just a moment. So all in all told, big shakeup happening here in Michigan as a result of the unwinding with those 3 fast facts put together. So with that kind of context, that kind of background, there's 3 things David and I want to help you do today. First, we're going to talk about some of those rule changes briefly in the under 65 and Medicare markets that affect enrollment periods and opportunities during the Medicaid unwinding. Then I will show you some no-cost tools you can use to locate some suitable communities for prospecting. And in a minute, we'll tell you why that might be important as well. And then toward the back end of our presentation, Dave's going to share some prospecting strategies that will help you remain compliant in your target markets. And especially here in this section, because we're talking about all individual business, whether it's under 65 or over 65, your Medicare business, compliance is going to be key to protecting you and your clients going forward. The first thing we want to help you with today is get a handle on some of the rules that are changing, at least temporarily, in your markets. And we'll talk briefly first about under 65 and then talk about what's new to think about in the Medicare realm as well. I almost said Medicaid. Medicaid, Medicare, a lot of tricky wordplay happening here today. So let's talk about the under 65 market in particular. And And we're going to assume that we know that the state Medicaid agency, in this case, here in Michigan, right? Maybe you're joining us from Indiana or Ohio, though. So I'm just going to say state Medicaid agency as a blanket catch-all. That state Medicaid agency is undergoing redeterminations and will be doing that for the next 12 or so months. And when that agency has found someone that is ineligible for Medicaid or CHIP, whatever the case might be, that Medicaid agency is going to notify the marketplace. The marketplace then will will send both a letter and an email to that consumer to invite them to apply for coverage on the marketplace. Now, of course, when you're going to the marketplace, that consumer can be eligible for advanced premium tax credits and or cost sharing reductions, and depending on whether or not your prospect or consumer has made more income or less income, or is right there on that Medicaid threshold, CSRs are probably on the table for them. We should point out that consumers, when they are invited to apply, should begin a new application unless there is already one in progress for another reason that they might have started one. What is new, though, and here is the big thing to pay attention to, is that there is a new continuous SEP for those who lose Medicaid or CHIP, and that SEP is available through July 31st of 2024. And getting this SEP is relatively simple as far as SEPs go. On the application, there's two questions that your prospect or consumer will need to say yes to. First, there's a question about whether their Medicaid or CHIP coverage will recently end or will end soon. And your prospect or benefit or client will need to attest to that Medicaid or CHIP loss between March 31st of 2023, when redetermination started, and July 31st of 2024, when redeterminations are mandated by law to end. As long as they say, yes, I've either lost Medicaid, and they can attest to it and give you a specific date, they'll receive that SEP, though we should note that the marketplace may come back require that determination letter. So don't lose them, and encourage your clients and beneficiaries not to lose them as well. From there, once they have 60 days from the date of application to select a plan. So as soon as they submit that application, it goes to the marketplace. They have 60 days to select a plan, hopefully with your trusted and expert guidance. And that's it. There's that one's simple. Nothing else to say on that one. Just a 60-day SEP from the date of the application. Although we should point out that means they could apply on July 31st, 2024, and still have 60 days from that date to take advantage of this SEP. Let's talk briefly about effective dates here as well. Generally speaking, coverage is effective on the first of the month after plan selection, but there's a little bit of nuance to talk about here. So if your consumer, your client, your prospect indicates a future loss of Medicaid or CHIP coverage, coverage is effective on the first of the month following the termination of that coverage. So if on the application we say my Medicaid or CHIP will be terminated on July 31st, my marketplace coverage would be effective on August 1st. If you do indicate a past loss of coverage on the application, so say I'm right here today, I actually lost Medicaid or CHIP at the end of April, which is not possible, but for example's sake, if I lost Medicaid or CHIP at the end of April, and I'm only applying here today, 25, 30 days later, my effective date wouldn't be till the first of next month. So that future or past loss Medicaid coverage is important to know about when you're thinking about those possible effective dates. Should also point out that sometimes your consumers may be eligible for two SEPs. When that is the case, while this ongoing or continuous SEP is happening, they're going to be given the effective date associated with the unwinding SEP, unless they have a different SEP, which would give them a retroactive effective date. There aren't that many of them out there, but it is one thing to consider for your clients as well. One thing I should note, though, that is blatantly missing from this process is carriers aren't named explicitly here. And because carriers aren't named explicitly here, neither are organizations like yours or mine. independent health insurance agents or field marketing organizations. Kind of cut out of this process, right? There's no big list, so to speak, of who is losing Medicaid. There's no big list that's being given or distributed to agents. And to be fair to carriers, we have heard from as recently as last week from Priority Health that they will be distributing some leads out to agents. Keyword there is some, right? And think about that from the business standpoint. From a carrier, if I can keep some of that business in-house, right, and I have my own either captive agents or my own enrollment specialists, and have that business there, that could make a lot of business sense, right? Although I might distribute some leads out to the agent community as well from the carrier's perspective. That means that as agents, to take advantage of this unique opportunity, you've got to be sort of aggressive, or not even sort of, just aggressive in finding where you want to go and how you want to take advantage of these opportunities going forward. And we'll show you how to do that a bit later in this session. I want to point that out here. There's no big list that we have and that we have access to, no big list anyone can sell you, because that list is strictly between Medicaid and the marketplace. So we've got to be clever in how we find these prospects otherwise. There's some new rules in the Medicare market to attend to as well. And these rules, for those of you who may be attending from out of state, so Indiana, Ohio, these rules are specific to Michigan. Well, especially the last rule there is specific to Michigan. Let's talk a bit about them. So again, as a part of the unwinding, states have restarted Medicaid eligibility checks. And if you have a senior who delayed enrolling in Medicare and were enrolled in Medicaid, they may take advantage of a new 6-month special enrollment period for Medicare Parts A and B, and that is outlined by CMS. That 6-month timer starts on the date they are notified Medicaid coverage is ending. And to enroll in Parts A and B, they must complete Form CMS 10797, the usual form they need to complete to enroll in A and B, and return it to their local Social Security office to enroll. That A and B coverage will be effective either the month after they enroll or the date their Medicaid coverage ends, whichever the beneficiary chooses, depending on when they enroll. Because you might have people over the next few months that are new to Medicare A and B, we should also remind ourselves of those initial enrollment period rules for Medicare Advantage plans. So if they're new to Medicare, they might enroll in a Medicare Advantage plan within 3 months after the start date of their Medicare coverage. So if, for example, you have a beneficiary who's received a letter terminating their Medicaid coverage on July 31, there's 2 things they could do there, right? If they applied for Medicare prior to July 31, they could begin their Medicare coverage on August 1, rather, as well as an MAPD plan if they've so chosen. And they would be able to enroll in that MAPD plan through the months of July, August, and September in that particular scenario. Oops, let's go back. Got ahead of myself. Let's also talk about guaranteed issue rights, and this is specific to Michigan. So if you are in Indiana or Ohio, cover your ears for just a moment, because this is one thing unique to Michigan Department of Insurance and Financial Services. So normally, under regular circumstances, folks who are new to Medicare Part B will have a 6-month window to enroll in the Medicare Supplement plan without being subject to medical underwriting. So they're not going to pay more due to their health status. That's what we all refer to as their guaranteed issue period. But if you have someone that's lived in Michigan and received Medicaid throughout the pandemic, they may have another guaranteed issue right available if they meet certain conditions. First thing is they've got to be enrolled in Medicare Part B when they apply for that supplement plan. Well, yeah. Second thing is they need to apply for that Medicare supplement policy within 63 days of the later of one of these 2 dates. Either the date they were notified they were losing Medicare, or the date, Medicaid, or the date they actually did lose Medicaid. So in short, creating a 63-day SEP or guaranteed issue period for Med Sup plans from the date that they lose Medicaid coverage could be important to know, especially for folks who maybe have children at home, right? Children that are Medicare, children who are disabled, they're enrolled in a Medicare supplement plan, and they do have an opportunity to take advantage of this SEP or these guaranteed issue rights if they so choose. This order is good through 90 days after all redeterminations have been completed. So this particular order, we're talking about the last bullet here. So if determinations are scheduled to end in June of next year, you've got 90 days after that. After that takes you through September, where this exception will be exhausted. All that said, so those are some of the big rules. I want to get to that prospecting stuff. But before I do, want to see if there's anything we can clarify about some of the rules we've talked about here. Also want to hear what you're thinking. What seems important for you to remember about the rule changes in your target market or markets? So please put a few words in the chat or ask David and I any question you might have about the rules we've talked about so far. Seeing a few of you call out, and remember, you can in the chat either choose to chat privately or just to David and I. Some of you are calling out right away that supplement rule is huge, right? Possibly for over 65 members, but particularly for Medicare beneficiaries who are under 65, that could be a big deal. Also, that continuous SEP on the marketplace is being called out too. Lots of appreciation for that. That gives a lot of folks a pretty good opportunity to secure other means of coverage if they do get rolled off of Medicaid. David, before we move on, anything to add about either the marketplace or Medicare rules that we have not talked about already?
Well, I think it's interesting to me in all of this process, as you pointed out, that there's not a solid list for carriers or anyone to distribute. And beyond that, the federal government has planned on the marketplace really being the pathway for this. But it's important to remember, as you hear from your clients all the time, that marketplace pathway is a really, really confusing experience for folks who aren't savvy about their insurance coverage, about the rules. So these folks are going to need a lot of guidance. And I've heard from a number of experts, including folks at CMS, that really expect agents to play a major role in this process of helping folks transition away from Medicaid. So, don't let that idea of automated notification from the marketplace, concern you. I think there's still going to be plenty of prospects out there that need your support to get through this and come out the other side with good coverage.
I think so. And we've got so the key is then, where do I find these prospects? How do I zero in on some places where they might be? And spoiler, they might not be in all the areas you think they are, but we'll get there in just a moment. So let's talk about some no-cost tools for locating some prospect-rich communities, particularly in relation to the Medicaid unwinding here. And we're talking about some tools available from the U.S. Census Bureau. Yes, that Census Bureau. So we all know every 10 years we get something in the mail, or maybe someone comes to our door and collects a bunch of information about us. Big old survey, counts everyone who lives in the country, some demographic information, some job information, some economic information, and all put together in a nice, neat package for us. What you may not be aware of, though, is that in addition to that, every 10 years, census program, there's over 180 other surveys that the Census Bureau is in charge of administering. And particularly, what's of interest to us in this session is a combination of 4 different surveys, and we'll show you how to pull that data together in a quick visualized way in just a moment. First thing we should point out is the American Community Survey, and that is really more demographics. Who are you? How old are you? How old are the people in your household? That is run each December, and data is updated on the website each December. That is sort of like an interval collection period. It's like a smaller sample size of that every 10-year census, just to get a pulse of what's going on in communities across the country. Another pair of programs that we'll think about, and I'll highlight the state here in just a moment, is county business patterns and non-employer statistics. In county business patterns, they take a look at number of new businesses started, who owns those businesses, whether that is veterans, females, lots of demographic information there that you can take a look at if you were interested in prospecting the group market. They're not the sole focus of today's session. Non-employer statistics, they also take a look at where employees are moving in that survey. So are they leaving manufacturing to go to technology? Are they leaving hotels to go to restaurants or vice versa? There's a lot of data we can pull from the tool there. And that economic data is updated each June, some of which impacts what you're about to see. So I want to say that loud and clear. We're here at the end of May. The data we're going to show you will be stale effective here in June. So if you view this recording a little bit later on and you want to go to the website a little bit later as you remember how to do things, some of that data might look a bit different, and that's because it does update in June. We want to do this session here though today to give you an opportunity to dig in before these redeterminations really start in earnest. So you can start mulling around what your marketing and outreach plans might look like. There's also an economic census, which details more about leading and lagging economic indicators, looks more at household performance. That does happen every 5 years. 2022 data should be uploaded in March 2024. So again, we'll see another period in fairly short order where this data will be continually updated. So 4 tools, survey data all across the country. You may be wondering, Randy, how do I pull it out together? And the Census Bureau has a great tool for us to do that. We can put this in the chat in just a moment. I'll share it in a few different ways later on. But the Census Business Builder is where you want to go. It's a tool that the Census Bureau has built for businesses, i.e. you, to help you find the right communities to land in, where you can prospect, all those sorts of things. For small group employers or for group employers, if they're looking for a new community to do something or do business in, they can certainly take advantage of the tool in those ways. But the tool is really valuable for getting an idea of what the communities around us look like and whether or not our business could be a good fit for that community. So with that in mind, there are 3 big questions I want to help you answer today as we go over the tool. First thing is we'll want to take a look at which zip codes are most likely to be impacted by unwinding at a broad level. And then we'll take a look at some areas that might have seniors that need assistance with that Medicaid and Medicare transition. And then we'll take a look at some areas that might be most likely to have families in danger of losing CHIP coverage. And that's important, right? Because if you can help me take care of my children, you're probably going to be my agent for life, right? So we'll take a look at all 3 of these questions, going from real general and then zeroing in on 2 specific niches of the population here. I should also tell you that I'm going to be doing a live demo of some software here as we go into it. And when I'm thinking and navigating around, like I have a thinking face, my tongue is out, sticking out while I'm trying to find stuff. I'm not going to make you watch all that. I'm going to turn my camera off, but I am still here. It's not a recording. So want to give you the opportunity to pay attention just to this software as I switch my screen. And Dave, just let me know, are you in fact seeing the Census Business Builder here?
Yes, absolutely.
Okay. All right. So if I were to go to that address that Dave put in the chat here just a little bit ago, I'd be brought to a tool that looks a lot like this. And the first thing it's going to ask us to do is zero in on a location. And because Action Benefits is located here in Oakland County, Michigan, we're going to start there, but we'll take a quick spin around the state. Let's give you a quick tour of what you can see here on the screen before we dive into answering some of those key questions. Custom industries, we're not going to touch here today, but you can filter out a variety of industries by SIC codes and SIC clusters to look at how manufacturing is doing or how any other segment is doing in a particular geographic area. We'll use this here a lot. We'll look at variables to display on the map. There's socioeconomic, there's demographic factors we can take a look at. We'll also filter some of that data here today. If I ever want to change where I'm searching for, I can put in a geography here, and I can change the scale of what I want to look at. Right now, for example, I want to look at Oakland County. But if I want to go down to the city or town level, or even zip codes, or even down to the census tract level, which is the neighborhoods that make up those zip codes, that is entirely possible, and where we're going to find a lot of mileage here as we go forward. You'll see also in the bottom of your screen a brief dashboard. So if I were to highlight a particular census tract here, it's going to give us the total population here, because that's the variable selected, and show you some variety of bar graphs and statistics about that. And you'll also have your key over here. The download button, anything we do here today, as soon as you've got the data looking the way you want it, you can immediately download that list as a CSV and Excel file, probably what you're most likely going to use, and be able to use that and give that to lead gen or whatever other companies you want to consider here. We'll talk about that in just a moment later on. The other thing I should note is that everything I do here creates a unique URL. So or web address. So every time I add another variable here, or every time I change a filter, it changes and creates a unique URL. So when I get to a report I really, really like, I can simply add that report to my bookmark bar and come back to it over and over again. And it's going to refresh with the data that is most current. So if I wanted to go in today and put together a few reports and come back to it after June 1 when new data is published, that's an easy way to kind of accomplish this here. So if that's the lay of the land, let's talk about that first question. And we want to look at which zip codes are most likely to be impacted by Medicaid unwinding. So what we want to do is look at some of those zips that are maybe right at that threshold of being eligible or not. So here where I'm choosing variables, I'm going to go over to socioeconomic characteristics, economy being the key word here. And I would look at median household incomes. And if I do that, I'll go out to the screen. It's going to take a chance to load. And I can see, based on my legend here, I have median household incomes from 8,000 all the way up to 235,000 all throughout these census tracts. Maybe that's a bit busy for me. I want to zoom out a little bit to zip codes or the city or town level. That's easy here to do as well. But I also know that if I'm talking about people who are maybe Medicaid eligible or right in that borderline, then looking at people who are making 115,000 on average isn't real helpful to me, right? So I can filter that data down some. So I can add a filter. Again, we're looking at consumers and residents. I want to look at their socioeconomic characteristics and the median household income. Now we're going to bring this down here today to, let's say 40K, gives us a reasonable estimate of people who could be on that threshold here. And that data will populate and kind of gray out things that don't apply to my filter here. So if I'm looking for zip codes that have a median income of under 40K, well, there is a swath of them that exist here in Wayne County. Some of us might have been able to infer that. There's a swath of them that are here in Northern Oakland County in the Pontiac area. But if I were to zip around the state some, maybe I wanted to go up north, up I-75 a little bit, and come over to Harrison Township or Prudentville or St. Helen or Prescott or Mills, right? There's areas out there that could be prospect rich for this particular opportunity as well. Even if I were to go over here to Baldwin and these sorts of areas, I want to zero in on cities or census tracts, I can see what that looks like. So at the highest level, right, I can see right away where we might have some interesting opportunities to consider. As I come down, though, back to, let's come back to the Metro Detroit area here. And maybe I want to take that step a bit further. And I want to find out more about seniors, for example, that may need my help. There's a few things I can do to the data to maybe find some of those people who may be now eligible for a Medicare supplement that were not before. So I can change my primary variable. Instead of looking at socioeconomic characteristics, I want to look at demographics. I want to look at aspects of the people there. And I want to look for zip codes that have a population 65 years and older. So I've got that pulled up here. That's going to color change what's colored here. I also perhaps, though, know that income filter might not work for me anymore. So if I remove that filter, I can see, of course, the percentage of persons who are 65 in these zip codes all around the metro area. But if I added a filter, maybe I do want to look at income again. But maybe I want to look at those who might be right on, assuming, and this is a big assumption, but we got to start somewhere with assumptions, but assuming that people who may be Medicaid or who might have been on Medicaid and are now Medicare eligible, maybe they're living with a caregiver or they're living with a spouse, we're going to target a median household income with the upper limit of the FPL for that, which is $26,228. As we can see here, the data gets sort of slimmed down a little bit here, right? If I look here in the Detroit area, and again, I'm looking at city and town, there's not a lot of prospects here to consider, but fear not. If I were to zoom into the zip codes and let the zip codes populate, I can see that River Rouge might be a place to consider. And if I were to zero in on census tracts, there's a few more prospect-rich areas that I might consider, right? I'm looking at, again, people who are over 65 and right on that household income of for the FPL for having 2 household members. So I could, for example, zoom all the way into the census tract here and look at this area between 8 Mile, 7 Mile. We've got what's on over here on the right, Oakland and State Fair. So right around the state fairgrounds, I know that could be an area where I might want to do some outreach if I'm interested in supporting this portion of the population. But maybe that's not the market for you. Maybe, as I said earlier, you're someone who wants to help out families, right? Because if you can help someone with kids, you probably got a client for life. So we want to zero in on which areas might be at risk of, or maybe most likely to lose CHIP over the next coming few months. So I can change my variables again here. Maybe for the primary category here, I want to zero in on the percent of the people who live in that zip code that are under 18 years. I might also want to change up my filters here, right? So if I remove all my filters and zoom out just a tad, I can see the percentage of people who are under 18 years by all these census tracts. That gets a little muddy for the moment. Let's zoom out to zip code. But I can add some more filters to that data to really drive down on what I want to go to. So say, for example, I want to take a look at families of 4 is where I want to start. So there's a few things we can add here. We can talk about socioeconomic characteristics and filter by average household size. I know if I'm looking at families of 4, that average households of 0 probably aren't very helpful to me. But if I do slide that up to an average household size of 2, I'm starting to filter some communities out. And that 2 gives me a good possibility to catch either that family of 4, or maybe there's a single parent with at least 1 child that I could consider here and fall into this net. The other thing I want to take a look at, especially if maybe I'm interested in helping families, is again, adjusting income here. So I could go to demographic characteristics, click on socioeconomic characteristics, and try median household income again. But this time we want to bump it up to that threshold for 4 for at least 2023, which is $39,900. And with those 2 filters in place, and I know I'm looking for people that are under 18 years, I've got some more possibilities to consider here in the metro area, right? But again, this is only at zip codes that fulfill those criteria. If you really want to get the most of maybe door-to-door efforts or finding the right community centers to go, you could zero in on particular neighborhoods and census tracts. And this is going to take a minute to populate. But I could get north of 8 Mile a little bit. I could look into Southfield and look at this area here between 11 Mile, Greenfield, Southfield Road, and 10 Mile, and know that there's some potential families there that could be at risk of losing CHIP. And that might be an area that I want to spend some time, whether it's social media outreach, direct mail, maybe getting boots on the ground, finding, setting up the library there, right? All of those could be good options to sort of spread the word. So that's a quick overview of the Census Business Builder and how you can manipulate some of that data to zero in on communities that might be valuable to you here as you continue to prospect. Let me come back to the PowerPoint for just a moment, kind of recap what we've done. If you're interested in doing that on your own, of course, you can go to cbb.census.gov, which will bring you right to that tool we just talked about. Start by thinking about your target locations. Maybe you want to zero in on your own community first. You'll set those variables and filters. So you'll look at income levels, you might look at portions of the population and adjust the scale, whether it's city, state, zip, whatever's interesting to you. And again, as I pointed out earlier, you can download that data if you want to. You can generate a report that shows up on the screen the same way. And like I said, you can bookmark that link right away to always have something to go back to when you're interested in looking at that data. Let's pause here for a moment. I just took some time to chat here. What are some other helpful questions you could investigate? And if we have some time at the end here today, I'll try to dig into those. And if we don't have time, we can certainly set up some time for you and I to talk through, go through that data. What other questions might be helpful for you to answer using the tool we just took a look at? Go ahead and put some words in the chat here. So one of you pointing out that income levels will definitely change. Those FPL thresholds will definitely change. Should actually happen pretty soon in the fall. So as that does happen, make sure that you update your income filters here, right? As you're zeroing in on those communities, that could be good to remember here. Some other helpful questions. Of course, some people were interested in the portions of the group business I picked up on, not the express purpose of today's session, but certainly happy to set up some time and talk about that whenever you might like. So if I have this data, I know where these communities are that could use my help, in finding coverage, whether that's a Medicare supplement, whether that's the marketplace. What strategies and tools can I use that are still compliant to get in touch with them? Dave, I want to turn it over to you for that portion of our discussion.
Thanks, Randy. I appreciate it. So what Randy's shown you here is a great way to kind of hone in on areas, right? And I think as we talk about this population specifically, you have a lot of options as to how you market to them. And a lot of your best are going to be grassroots, which is great from a return on investment standpoint. Of course, your threshold for investment here is very personal. So we'll give you some strategies that hopefully give you some flexibility as to what you have to spend to reach these folks. And I'll be honest, this is an unknown to a great deal because none of us have been through this unwinding before. So my kind of central advice here is cast a wide net. But one thing you're going to see in a lot of the slides coming up is a note about compliance, and that is really, really critical as we talk about the unwinding. For anybody that works in the over 65 market currently, if you've ever tried to market yourself and Medicare services, you know that it is a minefield of rules and regulations about what you can and can't say, about disclaimer language, about carrier disclosures. And a lot of those rules are getting tighter and tighter each year to address some of the bad actors that are out there. Everybody likes to pick on Joe Namath, and I think it's a fair critique. And it unfortunately, it makes it very hard for agents to sell their services in that space. The trick with Medicaid is that, specifically with the unwinding, is that even the federal government treats this as a very new process, and the states do as well. And so there isn't a lot of clear guidance around compliance. Randy, if you would kind of take us, here we go. We're going to talk about a number of different mediums, a number of different channels you can use here, and I'll give you a little bit of detail in each of them. The thing to remember in a broad sense is that kind of general is often better here, and that speaks to the cast a wide net approach I mentioned. In terms of compliance, staying out of the weeds and using specific terminology around Medicare and Medicaid will serve you well. It's also important to think very, very carefully about the audience you're trying to reach here. These tend to be consumers who are not all that savvy about medical insurance. Many of the folks that gained coverage under Medicaid during the pandemic did so because they didn't have access to care beforehand. And so they probably come at this with less of a basis of knowledge about health insurance than some of your more affluent consumers. They're also folks who are very cost conscious. So as you think about how you present yourself as an agent, be mindful. I'm often, kind of dubious about agents that like to present their services as free, because it sort of undersells the value they really bring to it, and it doesn't explain the reality of how we all earn our living. But this is a market where I think there is probably some value in making sure you're expressing that there's no cost for your consultation, that there are no obligations, and that you're really a support system for consumers, just because of their level of cost consciousness. But the first option we want to look at here from a medium standpoint is direct mailing. You have a couple of options as to how you approach this. The first one we'll talk about is using a mailing house or a mailing vendor. This is a great shortcut around some of that work on census.gov for lots of folks, in that mailing houses have these tools and others at their disposal and are fantastic at creating lists to mail to based on any demographic you can identify. Income is always a good one because there is so much good data out there, ages very similarly. But if there is another factor you can think of that might, apply to this audience specifically, most mailing houses will be able to help you hone in on that. They're also very good collaborators in that they tend to be very full service or have good partnerships with other vendors. So if you need a graphic designer, they may be able to handle some of that in-house. They may be able to point you to a partner that they've worked with regularly, and so on. Similarly, if you have a good graphic designer, a marketing person you like to work with to develop creative for your advertising and that sort of thing, they very likely have a relationship with a mailing house. As somebody that spent more than 20 years of their career in marketing, I can tell you I have lots of those relationships. So if you need some direction there, you're always welcome to reach out to me too, and I can probably point you to some good folks locally. The next option from a direct mail perspective is great for kind of increasing ROI or at least reducing your costs. Every door direct mail is a service through the US Postal Service that allows you to target very effectively in specific areas, whether it's cities, zips, tracts, etc. And they literally just delivered every house in that zone that you identify. It tends to work very well with postcard mailings and low cost creative. Obviously, the bigger, heavier item that you want to send, the more cost is associated with doing direct mail. Every door, think of this as the postcards you get from all the local realtors and all of those business owners in your area that are just trying to blanket a neighborhood. This is the quintessential cast a wide net approach. Of course, when we talk ROI, you can't have that discussion without talking social media. It is, in most cases, among the most cost-effective things you can do to market yourself. And social media tools have great abilities to target specific geographies. From platform to platform, their ability to target on age varies a lot, and that's very often based on their user base. We know that Facebook skews older than, say, TikTok, although there is a great Medicare population watching TikTok these days too. Same is true for Instagram. It is tends to be a younger target audience than a Facebook. But again, depending on the social media you're comfortable with, your ability to produce effective creative for, it's very easy to hone in on a geography or some of those demographics. So if you're thinking in terms of the folks you want to target, using some of that census data, it's easy to draw a circle around an area on the map and focus your social media presence there. Of course, as I said, this is a very grassroots opportunity for marketers. And so when we talk about boots on the ground, again, you have to remain compliant. In the Medicare world, going door to door is a big no-no. I would say it's probably pretty avoidable here too, just for the sake of making sure you don't run afoul of any rules. But there are great opportunities within local businesses When you think pharmacies, community centers, senior centers, anywhere you'll find people that might fit into your demographic, very often to do informal events, set up a table and talk to folks and promote yourself. Leveraging bulletin boards at your local pharmacies or your hardware stores or anywhere else can be a great way to get in front of people in a very passive and easy way, very cost effective. So there are a lot of things you can do in those kind of circles, so talk to business owners, store managers at your local pharmacies, see if they have opportunities or if they'll create opportunities for you to get in front of their customers. I always, in the Medicare world, I've known a lot of agents who've done pharmacy events over the years and had great success with them. The key there is always getting to know the staff, the pharmacists, the people that are in the store all the time. Because if you're on their side, they understand your purpose for being there and that you're looking to help folks, they will help direct traffic to you. So don't underestimate those relationships and the value of them as you kind of approach that informal event. Randy, if you'll bump us one more slide up.
Do you want to talk a bit about the under 65 specific here and door-to-door being an option?
Oh, I apologize.
Yeah.
Yeah, absolutely. In the under 65 market, there is nothing preventing you from going door to door. If you have the wherewithal and the interest, you certainly could literally knock doors and talk health insurance, or at least promote yourself, or flyer mailboxes. I live in a fairly urban community myself where our mailboxes are all on the porch. It's very, very common for me to open my door and find flyers, or even for folks to come around soliciting and leave a flyer if I don't answer the door. So it's certainly a possibility. That, of course, takes a certain level of comfort in your target area, and it probably works best close to home. I think folks respond well to agents and business owners that are in their community. But again, oh, sorry, my motion lights here in the conference room just kicked out. Again, look to stay compliant, but there are other community events, whether it's art fairs, street fairs, food truck festivals, music festivals, any kind of a community event, and even down to your local PTOs, PTAs, schools, school athletics. They tend to be very, very cost effective. It's great if you have local proximity to them. You're supporting your community and organizations there, and people respond to it. PTAs are fantastic in this sense. When they're doing their fundraising, they'll get your logo on shirts, they'll get you on signage, they'll put you in every piece of collateral they produce. And it's very, very reasonable most of the time. So again, thinking to that compliance point, be careful about the creative you use. Recognize that simple and wide net is probably the way to go. Present yourself in language that resonates with the folks you're trying to reach. So don't get too far into the weeds with acronyms and industry jargon. Talk in terms of health coverages of, if you're going to talk about markets specifically, talk health insurance, talk government programs, talk about your expertise. And don't be afraid to use some emotional language, because for a lot of these folks that are losing Medicaid coverage, they do have very significant concerns here. They're worried. They feel frustrated by the process, by the experience. Words like those can really help connect to an audience. So 6th option here, this is something agents need to be doing all the time, consistently, and folks that do it benefit greatly. It's always seems so basic, but it never hurts to bring it up, because I know even in my life in sales, it's hard to remember and stay on top of, but make it part of your referral ask. Remind your clients that are satisfied with the service you've given them that referrals are the lifeblood of your business and you love helping people. So if they have friends, that they can refer, if they know folks. And in this space, I think it's very safe to talk in terms of Medicare, Medicaid. If you're just having a conversation with somebody, obviously compliance is a pretty low bar. So don't be afraid to ask, who do you know that's losing Medicare coverage? Medicaid? Who do you know that I could help get through this transition? That ask can go a long way. And, I think about some of the sales training I've been through over the years. Our prospects generally fall into three categories for, their willingness to refer. You've got a huge chunk of folks, probably 50, 60%, that will refer just because they're happy and, they appreciate what you've done. And if they have an opportunity to send you out, they will. You've got another probably 20% that never will. They just don't believe in referrals. But then there's another 20, 25, somewhere in their percentage that honestly don't realize that you would appreciate a referral. So getting to those folks and making it clear that you would appreciate helping their friends and so on and so forth really can up your referral numbers. Again, stay compliant. Remember that in the Medicare space specifically, there are rules around any kind of incentivizing for referrals. It's a practice to avoid. Most of the time, if you've done your job and done it well and made the client happy, you probably don't need to incentivize them anyways, but it also never hurts to follow up with a thank you. So I think that covers kind of the basics of grassroots marketing in this space. Are there strategies in there that feel like they'll work for you? Are there options that you think are better, as we think about unwinding specifically? And, other than that, what questions do you have about marketing? I know it sometimes feels like a foreign language to us insurance folks, but I assure you, I have lots of experience with it and feel pretty comfortable discussing anything you can throw at me.
We did see one suggestion coming in the chat from Jessica here saying that, of course, on your personal social media, people are going to be complaining, right? Someone might reach out and say, oh man, I've lost my Medicaid coverage. What do I do next? That is an opportunity for you as an agent to kind of swoop in and say, well, hey, I can help you with that, or let me help you with that. So good feedback there. Other folks, of course, saying that the referral ask is key and making that quick tweak might be helpful to them. So yeah, lots of good discussion here and different things that could help us out.
Yeah, I think Jessica's point there is really, really good. And it also makes me think, don't be afraid to post on your social, whether it's your LinkedIn, your Facebook. Find good information out there, stories about the unwinding, any information that you can get out there that helps present you as an expert, as a thought leader, and spurs some discussion. Somebody rolls through their feed and sees you posting good information from a credible source about this, they're going to think of you if it applies to them. And it may lead to some good inbound for you. So always good to stay active in the social space as well, even beyond, paid advertising. So great thought there, Jessica, for sure.
Absolutely. And if, as a plug for what we do on the marketing team here as well, if you are maybe not someone who scrolls through social regularly, we often on our own LinkedIn page post a variety of articles. Take what we post there, use those articles, use our words if you want to, put them in your own words, do whatever you want to do, take advantage of them, and use those as another tool you could use to kind of inspire content that is client facing. That said, we do want to thank you for your time today. I always appreciate spending time with our agents and appreciate each and every one of you spending time with us here this morning. You can always find us on LinkedIn at the Action Benefits Company. You can email us always at info@actionbenefits.com or reach out to us at our main line, 248-356-8585. All that said, Dave and I are happy to take any questions you might have, but seeing as that we are very close to the top of the hour, we realize you might have to go as well to your next appointment. We will get a recording of this out to you in fairly short order, likely tomorrow morning. So fear not, that will be coming to you soon. But otherwise, I'm going to stop the recording right here, just so we don't have a bunch of dead end. But Dave and I or dead air at the end of the recording. But Dave and I are happy to stick around and answer any other questions you might have for the next several moments.